Welcome to your Employee Benefits Overview video provided by 208 Benefits. The information provided in this video is to help you understand your benefit options, pricing, and how to complete your benefit elections prior to your open enrollment or new hire completion deadline. Please watch or share this video with anyone that helps you make your employee benefit decisions for you and your family. You can refer back to this video, pause this video at any time during the initial viewing and during your benefit plan year. First, let's review your benefits and then walk you through the features of your benefit information website. This is your open enrollment benefits overview. The benefit plan year is November 1st, 2023 through October 31st, 2024. So all the information that we discuss in this video will be specific to that benefit period. Your benefits package is a comprehensive benefits package. It includes medical insurance with a telehealth component, a health savings account plan option, short-term disability. In addition, it includes life insurance, accident injury, voluntary major illness, dental, and vision plans. Quick insurance terms we want to refresh. You can pause this video, pause these screens at any time to read the additional information to help you through your plan year. So some simple terms you should know. Copay, fixed dollar amount that the member pays for medical services such as a doctor's visit or prescription medication. Deductible, the amount a plan member is responsible for eligible medical services before the health insurance begins to pay a portion of costs such as your emergency room visits, diagnostic exams, hospitalization, surgery. Coinsurance is the percentage of the eligible medical expenses that is shared between the plan member and the insurer after the plan member meets their deductible. And the out-of-pocket maximum or limit is the most that a plan member will pay per individual on their plan in a calendar year. This will include the deductibles, copays paid after the deductible, and coinsurance. Once the out-of-pocket limit is met, the insurer pays 100% of all eligible medical expenses incurred in the calendar year for that plan member. You have a health savings account option with one of your plans. And the health savings account is a type of savings account that lets you set aside money on a pre-tax basis for qualified medical expenses, such as what you would pay towards co-payments, deductibles, coinsurance, prescriptions for medical, dental, and vision care. The HSA funds are owned 100% by the employee. They roll over year to year if unused. They earn interest and also can be invested in retirement savings within the HSA account. You must be enrolled in the HSA eligible medical plan option to set up the HSA and to contribute funds into the HSA. The funds that you contribute into the HSA are pre-tax, therefore you are not paying taxes on those dollars, which helps your dollars go further. Just note that the HSA medical plan type does not cover any medical expense except for preventive services before the deductible is met. Regence will continue to be your medical insurer and will review the plans available for this benefit plan year. There are 2 network options that you have available to access. 4 of the plans will utilize the St. Luke's Health Partners, which includes St. Luke's, Primary Health Medical Group, Sulcer Health, plus other providers. The Regence PPO includes the St. Luke's Health Partners and about 96% of physicians and hospitals in Idaho, including also the Blue Network throughout the United States. What you're seeing here are your 5 plan options. So you have 4 plan options with the St. Luke's Health Partners and 1 with the Regence PPO. Plan 2, as you see here, is the HSA eligible plan. That's why you'll see this indication here. And then these are your other 5 plan options. You are simply choosing the plan that makes sense for you. Please pause this screen and review the options further. We'll also bring over your benefit information website to show you more information on where that plan is located. So if you look at your upcoming plans and you click on the regions tile, you will see the benefit summaries for each of these plans and the little PDF icons. So as an example, if you're looking at the 3250 plan, you can go ahead and pull that plan up and you can view the summary here. So you can go into the more details or simply come back to the plan itself and review this screen. Moving forward, preventive examinations on all medical plans are covered at no cost to you. That means no copays, no deductibles, co-insurance do not apply. These are the specific types of preventive examinations that are eligible. Your plan documents will show you the full list of eligible preventive exams for yourself, your family members as well. Regions additionally has an employee assistance program. We refer to it as EAP. This is confidential counseling for life events that can be done face-to-face, on the phone, or video chat, plus other types of consultations, crisis help, peer support groups, also as part of your region's plans. You can access them anytime through your member dashboard. You also have member wellness incentives for taking care of your health assessments in a biometric screen. You complete the health assessment on your member dashboard. You complete the biometric screen by going to Quest Diagnostics or requesting Quest Diagnostics send you the home kit. Once you've completed step 1 and step 2, you will be able to claim your $100 electronic gift card by redeeming the points on your member dashboard. Prescription savings. Your medical plans do have prescription coverage. However, each plan is different as to when it covers certain prescriptions and or the co-pays or deductible co-insurance expense before they cover those prescriptions. We want to provide you an easy alternative to saving money on your prescription plans, especially your generic prescriptions. So again, don't overpay for prescriptions. Download the CleverRx mobile app to unlock the exclusive savings. Enter the group and ID number here, and that will unlock those savings for you. Once you have the app downloaded, you simply type or speak the name into the app of the prescription you've been prescribed, see the list of pharmacies, select the pharmacy for your convenience, and present that voucher to your pharmacist at the time you check in to get that prescription. 40% of generic prescriptions are less than $10. On your medical plans, the generic prescription costs generally are around $25. So don't overspend by just giving your medical ID card. Utilize the app to get better costs. All employees will be covered with short-term disability. Short-term disability is your paycheck protection. We want to make sure that you have this protection in place so that if you're hurt off the job, you have an illness, or if there's a maternity, childbirth, if you're a female employee, you have that income protection. Enrolling in short-term disability insurance provides you a weekly income benefit to help you and your family meet your everyday living needs as well as your monthly bills. How the plan works for you. The plan covers 60% of your gross income paid in a weekly benefit. For most persons, that's going to realize about 75 to 82% of their take-home pay. That's what that 60% of gross income feels like from your paycheck reimbursement. There is a benefit deductible. It is the first 14 calendar days, meaning that you are responsible for the first 14 calendar days of your disability, and then on the 15th day here, your plan will kick in to pay the disability benefit, and that duration is 11 weeks per disability event. If it is maternity, the disability duration reduces down to 4 weeks for normal delivery and 6 weeks for C-section delivery. All your benefit details are on your benefit website underneath the short-term disability tab. When you're in the enrollment platform, when you are electing your benefits, this is automatically elected for you, and it'll show you here what your weekly income benefit would look like based on your current wages. Your group life insurance benefit, also very simple, provided for you by your employer. It's a $25,000 benefit. If you were to be deceased during your time of active full-time employment, your beneficiaries would be provided that income benefit. Please update your beneficiaries in the enrollment platform. You can do this at any time as well as open enrollment or as you're a new hire. The accident benefit, also provided for every employee. An accident benefit is an important plan that pays cash benefits directly to you for any type of injury event that occurs off the job. So we'll give you some examples of how the policy pays out. If you were to suffer an upper arm fracture that required surgical repair, there would be a $3,000 benefit payable. If you had a lower leg fracture that also required surgical repair, there would be a $5,000 benefit payable. If either of these injuries do not require surgical repair, there is a non-surgical benefit, which is roughly 50% of the surgical repair benefit. These dollars are sent directly to you. You use them how you see fit to take care of your out-of-pocket medical expenses, including your deductible, co-insurance, etc., or your everyday living expenses. It is your money. You do with it as you see fit. This will give you an additional example of the benefits payable and the types of injuries that your plan covers. Your major illness benefit is a similar type of benefit that you can voluntarily add to your benefit package. This pays a fixed benefit amount for the diagnosis of a specific serious illness experienced by you or anybody covered under your policy. Again, the benefits that are payable through this policy do not impact your medical insurance, meaning that it will not lessen what the coverage is on your medical insurance plans. Covered illnesses include heart attack, invasive cancer, stroke, and a list of other illnesses that are there for adults and also childhood illnesses. You choose the level of coverage that you think is right for you. Employees can choose up to $15,000 as their benefit. It starts at $5,000 and goes up in $5,000 increments. Spousal benefit is 50% of the employee benefit, and children are 25% of the employee benefit. Note that children are added to the plan at no additional cost. So if you are enrolling yourself, we do recommend you add your kids to the plan as well. That way you have that financial protection just in case something happens. When you're in the benefit platform, you will see here that you will have drop-down menus to select the amount of coverage that you choose. And when you do that, you will also see that update in your shopping cart and show you exactly what the cost is for the levels of coverage that you choose. So that makes it easy for you to gauge how much coverage you want and the cost to have that coverage in place. Moving forward to your dental benefit. Now this goes back to your insurer regents, so your medical and your dental plan will be with the same insurance coverage. Let's go through your basics. This is an annual benefit of $1,000 per member enrolled per calendar year. Preventive services, you pay 0% when using in-network providers. That includes your routine exams, your cleanings, x-rays. Care beyond your preventive requires a deductible, $50 per member with a maximum of $150 per family. That includes basic services. After your deductible, you pay 20%, the insurer covers 80%, and your major services is split 50-50 after deductible. Your plan also does have a rewards benefit. If you use less than the benefit maximum in the first calendar year, a $250 benefit will be added to your maximum benefit for the next year. And in subsequent years, again, if you use less than your annual maximum benefit, an additional $250 will be added the following years. The total combined benefit can meet up to $2,000 per individual. So an excellent feature for those that may not have a whole lot going on for a couple years, and then you have some more dental care needs, you're going to have more benefit within your plan to cover those things. Your vision benefit is backed with principal utilizing the VSP network. Your vision plan summary is as follows. Eye exams are $10 when you're using in-network providers. Your lenses for your eyeglasses are a $25 copay. Your frames are a $150 allowance. And your contacts are a $150 allowance as well. Please note that lenses and frames are only utilized within the initial access date here. So you can use them every 12 months. You just can't use the same benefit in the same 12-month period. Your frames allowance is $150. That can be utilized every 24 months. So just just recognition of that. And your every 12 months is not the calendar year, and it is not the benefit plan year. It is simply the anniversary date of your first access of care. So if you have not utilized your vision benefit, please use it quickly so that you can utilize it again 12 months later. All right, so that is your benefit package in a brief summary. Go ahead and come back to this video at any time to review the information, to pause any of those screens to learn more about your benefits. For now, what we'll need to do is review your new benefit information. So let's go ahead and pull that over to your benefit website. So here is your benefit information website. This is where all the information is housed that we just discussed in the overview video, where you can dial in deeper into the plan types, etc. So you do have here a drop-down menu that'll show current plans, which means the plans that you are currently in that will end in this benefit period. And then you have your health insurance plans here. So you can, at any given time, just go here, click upcoming plans, and review this information. Your health insurance plans are here, your member guide, the video how to use the member dashboard, the benefit summaries for each available plan is here, a provider search is here. Please note, when we use the provider search, there are a couple things that you'll want to do. It typically wants you to sign in to your member dashboard before looking, but what we can do is just simply look at the benefits here. Just type in regions at the top here and scroll down to the employer-sponsored plans. You'll see Preferred Network, Regents, Accord Network, St. Luke's Health Partners. You have the Preferred Network option and the St. Luke's Health Partner networks. And so when you click here, you can confirm your selection. Now always make sure that you go up to the location piece here and then punch in your location just to make sure it's searching the right areas. And then you can search by doctor name, you can search by specialty, by type. We can look right here as a matter and just go through primary care providers, and it's going to show you the results of the persons that are eligible in network for your plan, etc. There's also a prescription coverage search, a prescription drug list that you can find right here. Your group ID number is right here. If you ever forget that or forget your member ID card, your member login to your member dashboard is here. Please make sure that you have set this up so that you can access your personal claims information as well as your additional wellness benefits, EAP, etc. Moving forward, you can also see your Doctors on Demand telehealth benefit. This is an excellent benefit that you guys can utilize for low-cost doctor's care that you can do from your smartphone, from your tablet, from your work computer that has web-enabled camera. You can watch the video here, shows you how it works, the benefit flyer. Just the note here, the key piece to this benefit is that if you're in a copay-based plan, you only pay $10 for a doctor's visit by using the app. So it's a great way to save money and get the care when you need it because it is available for you 24/7, 365. Okay? You can be at work, you can be at home, it could be midnight, it could be on a Sunday. You can access this doctor's care at any time. Moving forward, you have your Clever RX, you have your life insurance, your short-term disability, your accident. So when we click on these tiles here, you will see your benefit summaries. And then if you need to file a claim, you will always have a link here to help you file that claim. So we just want to come here. There is the claim form. There is the contact information, the email address you send the information to, etc. Same with the short-term disability here. You want to start that claim. It actually will allow you to do that online. Searching for your dental providers. Again, you have your dental plan information here, your benefit summary, a video about dental. You can find a dentist here. It is the same link that you would find with your Regents finding a doctor. So we can just punch in zip code, and then you can see the dentists that are in network. we'll bring this out a little bit. And it brings you up the dentists that are available in your network within 25 miles. You'll see McCall, Council, you'll also see Cascade, etc. in here if we punch this out a little bit. So again, your benefit information website provides you all the information that you need. Your benefit pricing is right here. It shows you what your costs are per paycheck, depending on the type of coverage that you have, employee only, or if you're an enrolling spouse for the whole family, and you'll see your medical plan options here. It'll tell you exactly what it costs per paycheck to be enrolled in these plans. And then as far as your EAP, your prescription savings, your telehealth, life insurance, short-term disability, your accident plan, those are all covered for you at no additional cost. You're just paying to add family members if eligible. When it's time to enroll your benefits, which is this period of time, you have this instructions here. You have a video here that you can watch to learn how to enroll and then go to the Benefits Enrollment Center. Once you're here, your email address is your username. Your password is obviously your password. If you're new and you haven't created a password or you forgot, simply click password, punch in your email address, and then it'll send a link to you. There are additional information on when you can change benefits, FAQs, definitions, personal life insurance quotes are additionally available in this platform as well. So with that said, this is your benefits renewal. We want to make sure that you have the rest of the information you need to complete it. So contact my office with any questions. Complete your benefit elections online. You do have deadlines. So if you are currently employed and this is your 2023 open enrollment, your deadline to complete your benefit elections is Tuesday, October 31st. If you are a new hire in the 2024 year, you have the 15th of the month prior to your benefit eligible date to complete your benefit elections. Please reach out to Jennifer with our Family Homes to get your benefit eligible date so that you can take access of it and enroll in the plans of your choice. Thank you. And if you have any questions, please feel free to reach out to us so that we can help you make the best benefit decisions for your upcoming plan year.